Hello, good afternoon, everybody. Welcome to the Cancer Language Training for Africa 2024.
It's an honor to have all of you on the Pink Africa space. That cancer is a formidable enemy. So we are here to run cancer down and run it to a standstill. Every healthcare professional or advocate deserves the ability to discuss cancer with clarity and compassion. By bridging the gap between medical terminologies and the patient, we can enhance patient understanding, reduce fear, and promote equitable access to cancer information.
The most important skill that we have to need is empathy and sensitivity. Therefore, we have to be slow, and we have to tell one by one, and we have to be sure that the patient is understanding what we are telling.
As the president of the Nigerian Cancer Society, whether you have 100 patients to see or you have only 5 patients to see, it is important that any patient that comes to you gets the best of care. So we just have to create the time, despite the fact that we don't have the time.
I was 6 months pregnant. I got told I had breast cancer. I discovered the lump myself. And it was a very scary journey. I didn't know if I could commence treatment or if I could wait till I gave birth. I was told to terminate my pregnancy. I wasn't told of any possibility other than that. I had to advocate for myself. I got to know a doctor who could treat me while pregnant. So I think that's the issue we're having with the communication gap. A lot of people know about cancer, but we really don't know about cancer. I'm quite learned. I read a lot, but even then, I am so naive when it has to do with the word cancer. No idea. It was such a scary topic. Nobody talks about it. Nobody prays to have it. And then if you know someone that has it, because you leave that person, I think it's communicable. So I appreciate forums like this, where talking about cancer is being normalized. If we can normalize speaking about, more people will come out to get treatment.
23 years now since I had that operation. I'm not feeling anything. What I'm telling my people is this, my young generation, our people don't believe in cancer, that they can treat cancer, that the hospital can treat cancer. They believe in other ways of treating cancer, which is not good. It does not help them at all. Most of them died.
Honesty is crucial. Our communication with the patient has to be as honest as possible. It must be delivered with compassion, and patients actually have a way of appreciating transparency, even when they are facing very difficult situations, even when the conversation is a difficult one, that the doctor, that the caregiver is transparent, open with them and honest with them is something all patients tend to appreciate. We must try to maintain a good balance between clarity and empathy. It's one thing to make the patient know you understand they could be going through a lot of difficult things. It's one thing to make them realize that, yes, they are not alone on this journey. They are cool. There are so many other people that go through it. There are ways of going through it. There is support on ground and all of that. Now, you are empathic with the patient in letting the patient understand that you also feel as a human being and know that whatsoever they are going through is quite a difficult situation.
I was a cancer advocate since 2008, and all I thought about lung cancer was, if you don't smoke, you don't get lung cancer. Not until 2017 that I lost someone very close that never smoked.
The first time I experienced the stigma surrounding lung cancer was as a teenager, almost 39 years ago. My dad had just died of lung cancer at 41 years old. One of my very close friends asked me, "Why are you not in a good mood anymore?" I responded and said, "Well, I miss my dad." And my friend's response was, "Well, my mom said it was your dad's fault because he used to smoke." The emotional scars left on me at 13 years old are with me forever.
I lost some friends because of my lung cancer. When I opened up and told people that I had lung cancer, they shied away from me.
When I would tell people I had lung cancer, the first thing they asked me is if I smoked, or how much I smoked, or when I smoked, or I didn't know you smoked.
Just treat me, just like any other human being with any other disease. Treat me for my disease. Don't saddle me with the stigma.
Words are powerful and they're important. And beyond those words, compassionate conversation is at the heart of a patient's experience.
The language guide is not about, do's and don'ts, don't, do this, don't say this, don't say that. It's a living document. The 4 pillars, use, person first language, eliminate the blame game, end the stigma, and equity. Person first language. Try saying the person or patient with lung cancer, or patient with breast cancer, rather than saying breast cancer patients, Treatment failed the patient, not that the patient failed treatment. It might mean, little, but it goes a long way. And in our society in Africa where, the doctor is the king, the doctor is like the god. So whatever the doctor says, sticks. So we need to, as, HCPs, healthcare providers, and to know the kind of languages or words that we say, to the patients.
I was diagnosed of breast cancer in 2017. I've done my mastectomy. I'm about 7 years old in this process. Cancer, you cannot fight cancer alone. So I want to really give kudos to Pink Africa Foundation. From time to time, they will call me to find out, have you gone for your checkup? Your checkup is due, you have to go for your checkup. Make sure you go. So I want to say a very big thank you to Pink Africa Foundation.
So I'm a breast cancer survivor. I was diagnosed of stage 3 triple negative breast cancer in 2022. To the glory of God, the whole journey took 8 good months. What I experienced some abuse of professionalism, yes, from the healthcare personnel at different points in my treatment period. One of the days, I went for my lab session to get my blood for the full blood count and all the procedure we passed through before the next chemotherapy session. The lab scientist, on taking my blood, he noticed my blood was foamy and dark. You understand? So the lab scientist, instead for her to have mind her work, you understand, she started giving me orientation on HIV. It's not a death sentence, and some people that are living on HIV, that are getting married, that are having children, that are doing this. If I was not aware, as in I was not enlightened, at least to have known one of us in the one or two things about the effects of chemotherapy on my blood, I would have just gone back home that day, feeling that plus the cancer I was fighting, that means in front of you have HIV on top. So that was uncalled for me. And then another part which I experienced abuse of professionalism was during when I was asked to do immunohistochemistry test. So I've done that. I got the result. So the day I wanted to go and collect the results, I went to the office. I was waiting for my result to be printed for me. Then one of the ladies came in. She's a medical personnel. She was busy talking about triple negative, that is a death sentence. She knows what she's talking about, triple negative. When some other colleagues were trying to tell her, no, it's not a death sentence. She said, I know what I'm talking about. I'm talking from experience. Triple negative, as long as the triple negative is the death sentence, it's a death sentence. The end product is dead. I was just keeping quiet. The highest thing I could do, I was with my phone, just lifted my eyes, looked at her. Then I returned back to my phone. Then just behold, when my result was printed to me, I checked my result. It was triple negative. So if I wasn't enlightened, because I told myself, even if it's triple negative, according to her that she said it's a death sentence, even if 99 people that have been diagnosed with triple negative die, that is their own portion. I will see the end of cancer. Cancer will not see my end. That was what I was always telling myself. What if it had happened to somebody that wasn't enlightened? Do you understand? And somebody that was not faith-filled. Do you understand? The person who would have even died before she even had the chance to finish her treatment.
Thank you so much, and I'm so sorry to hear about all that you've passed through. First of all, how are you? Are you feeling? Are you okay? How do you feel?
I'm fine. I'm very, very fine, as you can see. I'm very fine.
Yes, you're looking very beautiful. Thank you.
I did my post-treatment checkup 1 year after. The X-ray, the stomach scan, everything came out very fine. And even my doctor was telling me, whatever you are doing, continue doing it. They are doing amazingly well. So I'm doing amazingly well. Thank you.
We celebrate you. We celebrate you. We
Thank
love
you. Thank you.
And these are the kind of stories we want to hear. Thank you so much. On behalf of all the health workers in Nigeria, in Africa, all over the world, please, we apologize for the abuse in your own terms, that you had to endure during your journey of cancer. You'll be surprised that, and that's why this training is very important. Thanks to Pink African Foundation for organizing this training. It is very, very important. You'll be surprised that even a lot of cancer is still a strange, as common as it may sound, it's still a strange name, a strange disease. People still do not understand. Even the medical community are still trying to understand cancer. So I'm very sorry. I'm very sure those health professionals are now better. They are more educated now, and nobody will have to go through what you went through. And I'm so sorry. I was feeling so bad while you were speaking, but I'm so happy that you're doing well now. Thank you so much. We love you on behalf of everyone here. We love you and wish you all the best. Thank you.
As an oncology professional, it's just already been so enlightening, and I am very glad to be speaking on fostering patient and clinician relationships, especially after we just heard from multiple people who have been through cancer and are going through cancer, and cancer does affect all of us in some way or another, whether it's ourselves or somebody we care about, or of course the patients we take care of. There really is something very amazing about our jobs as clinicians. I'm a nurse. I know there are so many different types of people that are healthcare providers. And I do think, especially when we're very busy, we often forget the tremendous impact that we do have on patients during this time. And even though it's what we do every day, we are encountering patients at some of the hardest, most traumatic, most stressful periods of their lives. And it is an honor and a huge responsibility to be available to our patients. Burnout is a very, very real thing. And I think it gets worsened when there's a shortage. I almost left nursing, and I'm okay to say that. When I worked in intensive care, because I didn't think I could handle it. And I realized I didn't have any outlets and I wasn't taking care of myself. So once I made some changes there, nursing has become one of the best decisions of my life. And I'm so thankful that I'm a nurse. So
it's important that when a patient receives a diagnosis and gets some of the laboratory investigations out, it's good to have them clearly explained. I got confused myself at the stage. I got confused too, as I would say, as learned as I was. My friends back here in Benue breast cancer were sharing with me their experiences. They have done surgery, some have done chemotherapy. The next phase is radiotherapy, but it doesn't not clearly understood to them when they should do it, or how soon they should do it, or when they must do it, and if at all they don't do it, what are the implications, what are the consequences. So for us, for a patient, the communication should be as basic as possible, because like I said, once you get that diagnosis, your mind is closed. All you think about next is death, or will I survive? And then you need someone who is going to sit with you and carefully explain the processes you're going to go through, the processes, your steps to take, and even places where you need to go to get all of this.
As stated by the ICRP, International Commission of Radiation Protection, during the Vancouver Call for Action. So other components of non-verbal communication like active listening, positive body language, eye contact, and then professional touch are key communicating with this patient. In conclusion, though cancer is no respecter of status, class, language, however, it is curable, it is not contagious, it is not a cause or a death sentence. Our journey towards improving cancer care in Africa requires us to transform the way we speak, the way we think, and the way we act using a respectful language that is devoid of blame, stigma, and superstition. Thank you very much.
As we try to navigate and see how best we can break the myths on cancer, break the silence on cancer in a manner and in a language that will be more appealing to the people that we serve, it's going to serve us better. So thank you so much. I have seen that we also have Zambia joined in the call. So we thank you in all the different countries that you're joining us from. So right about now, we are going to have a cancer story by Paulo.
My name is Paulo, Calabar, Nigeria. I got diagnosed in 2019 in South Africa. And I'll go straight to, the language of the challenges around. Nobody ever told me that I had cancer. I was rather told that I needed radiation to prevent a reoccurrence, and I was referred to a radiation therapist. I didn't know what all of that meant, apart from the fact that, okay, it was going to prevent the reoccurrence of the tumor. I went, saw the therapist, had various sessions of orientation. The therapist too did not mention the word cancer. Cost for radiation was too high. I couldn't afford it, go back to Nigeria to raise money for it and go back. In the course of trying to raise money, I broke down. And I thank God that Dr. Hannatu Ayuba is here. Dr. Ayuba is a superstar. I give her 21 gun salute. Providence brought us together, and she did a fantastic job with me. To the language, I heard a couple of things. The one that blew my mind the most was early this year in January. I had to be in the hospital, and I went to the lab to give my blood for some tests. And the guy says, I hope it's not what I'm thinking. I said, what are you thinking? He said, cancer. I said, so the heck what? He said, oh my God, you're dead. You won't last more than 2 years. And then I said, I'm amazed that you, who is a professional, is telling me this. What would the man on the street say? And it didn't end there. 2 days later, he came to my room in the hospital to take blood from me. My wife was there, and he repeated conversation along those lines. It was so heartbreaking. It didn't move me. I had seen more than that. But the point I'm making here is that in line with this conversation and discourse, what I expected from a county demotivator or somebody who doesn't know at all what the situation is, the manner they should speak, was the way that the healthcare professionals spoke. And I just imagine what people like me go through at their hands around the world.
Clearly, from all of what we have heard, communication is actually both a skill and a tool that we need to develop. Because it's a skill, you can actually work on getting better at it, and indeed you should work on getting better at it. And I think it's also very important to understand that our patients will for a long time remember how they were attended to by us while they were at our various clinics. So what are our key take-home points? Communication is an integral part when you're dealing with patients who have cancer. You have to understand that these patients are going through so much. There are times in your clinic where to make a pronouncement of cancer is just so difficult. And once you say it, I've had dramatic experiences as a clinician myself. I think it's very important for us to understand that minding our language is pretty important. Understanding that when you're talking with a patient who has cancer, you have to engage with them with empathy as against sympathy. Putting yourself in their shoes and trying to see what they're going through so that you can best address their needs. And also, we need to know it's not a one-time thing and it's not a one-size-fits-all thing. Sometimes patients will need repeated counseling, and this can be exasperated, particularly when you think you may have done an excellently good job in the first instance or in the second instance, and then yet the third instance is coming up. Also, we need to be careful not project our personal beliefs onto the patient. We're clinicians. Our job is to discuss the science in a language that they can understand, to take time to break things down for them.
Thank you to all our faculty members, to our wonderful moderators, Dr. Musa and Adamu from Zambia. I want to thank all the wonderful people that have put this together. My president and founder, Dr. Jerry, and me, all the volunteers here that have worked tirelessly for the last 2 weeks or so, day and night, to put all of this together. I would like to thank Big Empresses, our survivors, now drivers. So I want to thank you so much for how much support you